Hi everybody, our team is going to talk about Johnson & Johnson Vaccine. I'm Abigail Miranda, and the rest of the team is conformed by Jesús, Iván, Leyva, Martínez, Ramón, Alberto, Alday, Grijalva, Stephanía, Orozco, Gracia, and Tania, Gradias, Minjarez. The dynamic is going to be like this. I'm going to make 8 questions, 2 for each member of this group, related to the Johnson & Johnson vaccine. That is very important on these days. We consider the best information that we think we are going to talk about, and we're going to start with my partner, Tania Gradias. And Tania, are you there, right?
Yes, hi.
Okay, thank you. We're going to talk about how was created the Johnson & Johnson vaccine. Can you talk about this a little bit, please?
Yes. This vaccine was developed by the company Jansen Pharmaceutica and was approved on April 23. This vaccine is based on a human adenovirus that has been modified and contains the gene that produces the spike protein of the SARS-CoV-2, the causes of COVID-19. And the body's immune system responds to these proteins from the spike to produce antibodies. So the vaccine requires only 1 dose and doesn't need to be stored and frozen.
Okay, thank you, Tania. And also, the second question for you is about how does the Johnson & Johnson vaccine works? Can you talk about this fact, please?
Okay. This vaccine is a multi-dose vial containing 5 doses of 0.5 milliliters. 1 dose it contains a 0.5 milliliters of adenovirus type 26 encoding the SARS-CoV-2 spike glycoprotein. And it produces in per-C6 all the cells lines and using recombinating the DNA technology. So this product contains genetically modified organisms and is painted with known effect.
Okay, thank you, Tania. That's the 2 questions that I have for you. And we are going to continue with our partner Ramón. Ramón, are you ready?
Yes, I'm ready.
Okay, thank you. You are going to talk to us about which are the advantages of this vaccine, the Johnson & Johnson. Please.
Okay, the advantages of the Johnson & Johnson vaccines, according to gold standard, are that they use an implicit, robust human response, and it is also easy to design and produce on a large scale. This will help to make a bigger and easier distribution around the world. Lastly, adenovirus vaccines have been found to be safe and well tolerated by the people who have this vaccine.
Okay, thank you. That's a great information. And also the last question for you, can you tell us more about how well is used the Johnson & Johnson vaccine? How many people use this vaccine? Oh, sorry, we're gonna change to Stephanía. Stephanía, please.
Yes, of course. This Johnson & Johnson vaccine is being using according to the New York Times newspaper in 43 countries, including United States, Germany, and Mexico. If there are quite a few countries, but not as many as AstraZeneca vaccine, that is in the first place, and in the second place, Pfizer.
Okay, thank you. That's good to know, Stephanía. Thank you. And also the other question that I have for you is, which are the principal side effects of this vaccine?
And well, according to the European Medical Agency, the most common side effects that people present are pain at the injection site, headache, tiredness, muscle pain, and nausea. These usually affects 1 in 10 people. counting, joint pain, few gills, and redness and sweating at the injection sites, they're also common. Already, the rarest effects that usually happen to people are Guillain-Barré syndrome, tinnitus, skin rashes, and thrombosis, where in the latter, more than 17 were registered according to the Center for Disease and Control and Prevention in the United States. And the recommendation they are making in the centers of application of vaccines is that if you present any symptom, take 2 paracetamol and the rest and hold.
Okay, thank you. That's nice. Thank you, Stephanía. And now we're gonna talk with Iván, our partner Iván, please. He's gonna talk about how many doses applies for the Janssen & Johnson vaccine. Can you tell us, please?
Hello, Abigail. Good afternoon.
Hi.
Well, all people for whom vaccination is indicated should be received 1 dose of Janssen COVID-19 vaccine. The OMS recommends administering the Janssen vaccine in a dose of 0.5 milliliters intramuscularly. A minimum interval of 14 days must be respected between the administration of this vaccine and that of any other vaccine against other disease.
Okay, thank you for that answer. And also, I have the last question for you. How effective is the Johnson & Johnson vaccine compared with other vaccines that we know?
Well, it's not possible to directly compare these vaccines because the characteristics of the respective studies are different. But the FDA analysis found that the Johnson & Johnson vaccine has an efficacy of 72% in preventing them of all the COVID-19 variants and an 86% of efficacy in preventing severe forms of disease.
Okay, well, thank you, Iván, for sharing that information. And we're gonna finish with our partner, Ramón. The last question of this video is for you. How do you suggest, Ramón, the preservation of the Johnson & Johnson vaccine?
According to the Center for Disease Control, the way to preserve vaccines is to keep them in a temperature between 36 and 45 Fahrenheit, while also being protected from the light. In this way, it is prevented that the vaccines should be discarded. And since the vaccines are put into the vials, they can be used within the first 3 months after the vaccine was packaged, or as long as the expiration date says.
Okay, well, that's the way we are going to conclude. I hope that this information, you find it useful. I think that it's very important that the people know this fact before and after taking this vaccine. And we hope that you enjoy this video. Thank you very much.